This is Todd Lucas, and I'll briefly discuss a case series of urethrocutaneous fistulas after PEPFAR-supported voluntary medical male circumcision, or VMMC, in 15 African countries during 2015 to 2019. Studies have demonstrated that medical male circumcision decreases the risk of HIV acquisition in men by about 60%. It's an important component of the HIV prevention strategy in many sub-Saharan African countries, where PEPFAR has supported over 22 million VMMCs. Urethrocutaneous fistulas, I'll refer to them as just fistulas from now on, are abnormal connections between the lumen of the urethra and the surface of the penile skin, typically located at the frenulum. In the context of VMMC, these are acquired as a complication of the procedure. The data source for this analysis was PEPFAR's Notifiable Adverse Events Reporting System. We reviewed all reported fistulas from 2015 to 19, performed a descriptive analysis, and calculated an odds ratio based on patient age. Note that these results have been updated since writing of the abstract, with one additional case. Over these 5 years, 41 fistulas were reported, with a median patient age of 11 years. This graph shows the distribution of ages, and we can see that all of them except one were in patients under age 15. You can see from this table that although fistulas were rare, there was a significantly increased odds of fistula occurrence in patients under age 15 compared to those age 15 and over, with an odds ratio of about 50. We also found that these patients often had more than one adverse event. 76% of the time, fistula symptoms were the first to appear. 68% of fistula patients had at least one additional adverse event, and in 3/4 of those patients, it was an infection. Finally, we found that fistulas typically appeared about 3 weeks after the VMMC was performed. In conclusion, fistulas were significantly more common in younger patients. The amount of time between circumcision and fistula appearance shows that it's unlikely that providers are cutting completely through the urethral wall. It's more likely a partial thickness injury that eventually gives out, or a suture violation of the urethra. The suture material most used dissolves in this 3-week time frame. Although infections were also commonly diagnosed, they typically appeared after the fistula. This analysis contributed to PEPFAR's recent decision to raise the age of VMMC eligibility to 15 years, which improves safety while preserving the HIV prevention effect. Thank you.